Okay. Good afternoon, everyone. And my phone says it's exactly 5 o'clock. So I'd like to call to order the February 10, 2021 meeting of the Knoxville Board of Health. And we'll start with a roll call. And Anderson, if you could conduct that roll call for us, please.
Absolutely. I did want to take a minute or a second to introduce myself. I know I've been introduced to a lot of you by email, but I'm very excited to be here. So I'll go ahead and cut the video and go ahead and go with roll call.
Great. Welcome.
Thank you very much. Dr. Diana Drake. Dr. Gocher.
Here.
Dr. Hurt.
Here.
Mayor Jacobs.
Here.
Dr. O'Brien.
Present.
Dr. Shamia.
Here.
Dr. Sousa. She had emailed she would not be on the meeting. Ms. Wagner.
Present.
Thank you. Dr. Buchanan.
Present.
Okay. I see you. And Ms. Roma.
Here.
Thank you.
Anderson, we felt an echo when we double sound. Why that?
I may have my volume up too loud. I don't expect to be chiming in on anything else, but I'll adjust that for the next time.
Okay, it sounds like
Pardon?
it sounds okay.
A lot of echo.
Okay. I'll make some adjustments for the next meeting. Thank you.
Okay, thank you. So we have established.
I think that might be us. I'm going to turn my video off and see if I can fix it.
Okay.
It sounds better now. Before Dr. Gocher was repeating himself in short order.
Do that.
I think when she muted it solved it.
Yeah, I think it's Anderson's feed that's causing this, Dr. Buchanan.
Okay, it's stopped on our end. So, you try your camera? Sure. Look, it works. But let's see if it comes back now that I'm unmuted.
It sounds good from my end, Dr. Buchanan.
Perhaps it's mine. Is that better?
It's better.
Okay. I turned my volume down. That must be the problem. Okay. Thank you.
So I believe we have established a quorum. And with that, the next order of business is public forum. And Catherine, if you are available to help us conduct the public forum, please.
Absolutely. So up first, we have Betsy Hobkirk. Betsy, if you will please state your name and address for the record, and you will have 3 minutes.
All right, thanks. My name is Betsy Hobkirk, and I'm an elementary school art teacher in Knox County Schools. Before I taught art, I worked in community public health for more than 20 years. So I've been experiencing the pandemic as a local public school teacher, as well as through the lens of public health. I request that the Board of Health continue the mask ordinance and to continue advocating for teachers access to the vaccine. I know this board does not have jurisdiction over schools, but your actions certainly impact schools. In January, several studies reported that there's little evidence that COVID spreads in schools or contributes to community spread when strict safety procedures are in place. I'm concerned that these headlines have been oversimplified into the idea that the virus can't spread in schools. And it's critical to look closely at the safety procedures that were in place during the studies. So for example, I've been looking at the study promoted by the American Academy of Pediatrics that was conducted by Duke University. And when the study took place, 100%, the schools were either 100% remote or students were going to school 2 days a week with 50% of the students in attendance. The students were cohorted and rarely mixed. They reported a high rate of mask adherence, and there was a clear plan for special needs students. And the school districts in the study were overwhelmingly rural, where rates were very low at the time. There was also a lot of education, and there was contact tracing and quarantining. So school transmission rates probably can be low when there's strict adherence to safety measures. But I am not currently feeling that safe in Knox County as a teacher, because I feel like we're not using that same level of mitigation strategies. And so, for example, currently 70% of students are attending in person 5 days a week. Physically distancing 6 feet apart is not possible most places. There's not enough room, not in my classroom, nor in most classrooms. Masking is inconsistent, it's not strict. The school reopening plan states students and staff will be required to wear a mask when physical distancing isn't possible. And that statement is kind of unclear and ambiguous. The cohorting of students is disrupted. When substitutes are not available, students are divided up and added to another class. And in elementary school, class cohorts are divided up and mixed with other cohorts every day for reading intervention classes. Physical barriers, sneeze guards are not provided, and ventilation systems have not been upgraded. Windows don't open in most schools. The doors can't be open because that makes us vulnerable to active shooters and other risks, and fans are not provided. So I come in contact with up to 500 unique students per week. So I don't take the risks of COVID-19 in schools lightly. I would like the mask ordinance to continue. That's a very strong way for you to support schools. So in conclusion, I thank you for your work during the pandemic. And in particular, I would like to thank Dr. Shania for frequently bringing up school issues in your Board of Health meetings for discussion and concerns. Thanks.
Thank you.
All right, thank you. Up next, we have Patty King, and this is Catherine Killen, by the way, with the Knox County Health Department, just to identify myself. But up next for the public forum, we have Ms. King. If you will please state your name and address for the record, and you will have 3 minutes. Thank you.
My name is Patty King. I live in Knox, Tennessee, Knoxville, Tennessee, in the Southern District. I don't want to give my address for personal reasons. Thank you for allowing me to speak to you all this evening. I would like to talk to you all about the PCR testing. First, I have a couple questions to ask, and I hope you guys will answer them later. First, what is the threshold you guys are testing at right now? If it is 35 or above, why have you not dropped it, as it has recently been shown by the World Health Organization, the CDC, and the FDA that not only agreed and admitted that the higher threshold of 35 or above is too high, and it's putting out high rate of false positives. In some cases, the false positives were 70%. Here's a couple of studies to prove this. The Woodworth Center, a New York State lab, analyzed the results of its July testing at the request of the New York Times. 794 positive tests with the CT at 40. With the CT at 35, half of those PCR testing would no longer be considered positive, and 70% would no longer be positive at CT of 30. A new study from the Infectious Disease Association of America found that at 25 cycles of amplification of PCR testing, positive are not cases, since the virus cannot be cultured, it's dead. And by the 35, 97% of the positives are non-clinical. PCR is not testing for disease. It's testing for specific RNA patterns, that is key pivots. When cranking it up to 75, 75% of the positive results are not really positive in any clinical sense. And since it cannot make you or anybody else sick. So to summarize, in regards to our current case-demic, positive tests as they are counted today do not indicate case of anything. And last, I'd like to speak to Dr. O'Brien. I have a question for you. In July, when you established the county mandates, you stated multiple times that you did not want to fine anyone for non-compliance. Yet you went before the beer board these last 2 weeks and testified against the two bars. So I was wondering if you changed your mind about the fines that are hurting small business. Thank you.
All right, we have one more participant this evening. Again, this is Catherine Killen with the Health Department. The next participant is Jennifer Sauer. Ms. Sauer, if you will please state your name and address for the record. You will have 3 minutes.
Sure. Sorry, I'm unable to do my video here, but my name is Jennifer Sauer. I live in Knoxville, Tennessee, 37920. As a parent, I've been very appreciative of the updates that we received from you all this summer about COVID. I was scared, I didn't know what was going on. So I really appreciate everything that you've done for our communities. I'm also a middle school science teacher, and I've been teaching here for 5 years. While wearing a mask is not a traditional part of our culture, it is finally becoming one. Mask wearing is not consistent in all schools, like one of the previous speakers mentioned, but in my personal experience, it has been when it is supported and reinforced by everybody. If the Knox County Board of Health never asked the mask ordinance, then I am sure the spread in schools would be much worse than it already is. And one case is already too many. Little by little, masking is becoming a part of our school culture. We still have positive cases in our schools, and not all students wear their mask correctly, but without a mask ordinance, I do not think we could get anyone to take the value of masking seriously. At the very least, I'm grateful that this year I've not worried about the flu or strep on top of this horrible crisis. I credit this to physical distancing and wearing a mask. Teachers and parents are worried about the current condition of COVID in Knoxville. And we now have this new variant that, as far as we can tell, is more contagious. I was shocked to hear that we currently have 6 cases of the variant here in Tennessee. My hope is that we will continue this mask ordinance until we are truly safely out of this pandemic. Masking is good, but as a teacher, I also feel like vaccinations would be even better, or together would be better. I really appreciate your support for teachers getting vaccinated. The sooner we can get this, the sooner we can be truly safe in the classroom. Thank you for time and support for our communities.
Thank you.
All right, this is Catherine Killen again with the Knox County Health Department. That concludes the speakers who registered for public forum.
Thank you. The next item on our agenda is the Board of Health members' comments to the public forum. So I'll open this for discussion from board members at this point.
So Dr. Buchanan, I'll take the cycle threshold concerns. This question has come up frequently, and from the Tennessee Department of Health lab and other laboratorians, cycle threshold, the PCR test that's approved to be used for COVID-19 testing is simply a qualitative test. It is not a quantitative test. It tells you somebody is positive or negative. It's not designed to determine how much viral load someone has and how many viruses are present, how much virus is present in the body or in the sample. So to use the test any other way is a violation of the emergency use authorization and not appropriate. This test is an accurate test. Different cycle thresholds are set by by the FDA and by different labs. So that varies. You can't compare test between each other very well, because if a different lab is doing it, it's slightly different. Their cycle threshold may be different. So I know people are concerned about it, but it really is a fact that the EUA authorized the PCR to be used as a test that tells you if somebody has virus or somebody doesn't have virus. There's no nuance there, and it's not authorized to be used in a different way.
Dr. Gocher, may I make a comment back, answer Ms. King?
Certainly, Dr. O'Brien.
She asked about the fines that were, and I don't even know what happened with the other case that was done this week, but I supported not fining citizens because of the mask ordinance or our mask public health regulation. That's what I was speaking to in July when we were talking about this. And that is what was meant at that time. Why did I appear before these two hearings? Very simple. I received 2 subpoenas presented to me by a police officer requiring my attendance at those hearings. So I was chosen. I don't know how that happened, that it was just me, but it was me. And so I was told to appear, and I appeared. So it's not that I am in favor of one thing or another, though that's a separate issue about being open after curfew. That was not what I was speaking about back in July, and just want to make that clear. And that I do follow the law. If I get a legal order to appear before a judge or a hearing officer, I do so. So that's my answer.
Thank you, Dr. O'Brien. Any other comments from board members on our 3 public forum speakers this evening?
Yeah, Dr. Gocher, if I could, and
Yes.
Dr. Buchanan might have to weigh in here. The state has issued guidance over the tiers for eligibility for the COVID-19 vaccine. That is what we have been following. Currently, that guidance is 1A, which is you go to the website and see, but it's the healthcare workers, mainly that.
Responders.
Yeah, I'm sorry, Dr. B.
Funeral home directors.
Right.
It's a pretty long list.
And we've also talked about the state recently, they're also going with an age criteria. Originally that was 75, then it was 65. They added 70 basically to kind of divide up that cohort. So all of a sudden you don't have a huge influx of people that are eligible for the vaccine. The vaccine is being driven by the supply that we're getting. Okay. And that's just a matter of fact. I mean, if we could get more supply, we would, but we're looking at a pie, and the pie is fixed at this point. Once more vaccine begins rolling, and really once the private sector and the private providers are able to get into the game, we'll see much larger ability to distribute and vaccinate people. But at this time, this is what the pie is. So if we get more of the pie, that means that someone else isn't getting as much as the pie. In order to mitigate that, that's why the state came out with the plan that they did. Many of you probably heard that earlier this week, Nashville unilaterally made the decision to start vaccinating teachers. We don't know what sort of impact that's going to have on the state overall, but I think that as far as I know, and probably Dr. Buchanan as well, we were following the state's guidance on this because that's what we thought that we had to do. And that's the reason, that we haven't discussed the teachers' vaccinations up until this point, because we weren't going to do so until they became eligible according to what the state was saying. So anyway, that's just a high level look at what's really happening with the vaccine and the distribution. It's important to note that no matter what happens, we don't control the amount of supply coming into Knox County. It is gradually going up, but nevertheless, it's not like we can flip a switch or demand that we get, thousands more doses. That's just not going to happen. So if Dr. Buchanan has any comments on that, but that's just kind of the lay of the land there.
Thank you, Mayor. Yeah, you very accurately summarized kind of the situation. We continue to have demand from our 1A1 and 1A2 groups, as well as the folks 70 and older. And as we've said, as that and when that demand continues to be high, we'll continue to vaccinate those groups. We are making headway with a lot of help from our partners and the vaccinating that the health department is doing. And as soon as it's reasonable and we're able to, we will move to the 1B group. It's not that we don't think teachers should be vaccinated. It's just that supply and the dictates of the state are controlling us, controlling what we can do. And we will continue to follow the state in this matter. And so look for changes in the state guidelines, and we'll follow those guidelines.
Dr. Buchanan, it's my understanding that the Tennessee Department of Health, or an agency of the state, gets a weekly allotment for the whole state, and then they divide that in some fashion, probably based on previous demand, to each area. Is that correct?
That's correct. They actually divide it based on population, and not just population in general, but high-risk group populations as well. So it's a pretty high-level mathematical formula to get it divided out among 95 counties. They're doing a lot of work to do that and trying to do it as equitably as possible. And I can tell you, being involved in our little county and helping with vaccinations and understanding how little we're getting, the state has a big job in doing it. I think they're doing a good job with it.
The state's plan has actually, been lauded as one of the better ones in the country, and it's based on, these tiers are based on the most at-risk people. So you get the vaccine to the most at-risk people first, and then go from there. And that's, again, if we could get 100,000 doses a week, we would certainly do that, but it's just not out there.
Thanks for those comments. Are there any other comments from our board regarding our public forum speakers this evening?
I have a comment, please. Dr. O'Brien and Mayor Jacobs, I hear what you're saying with regard to the vaccines and how we're following the model that the state has set up. And hearing from teachers this evening and previous to this evening, it's my understanding from what I've heard, there really hasn't been much confusion or complaints from teachers. I'm wondering if those who came to public forum this evening are concerned because of masks being on the agenda to be addressed during the Board of Education meeting this evening. And so I'm wondering if perhaps our speakers tonight spoke, Ms. Hobkirk and Ms. Sauer spoke about masks also. And so I think I'm wondering if maybe they were saying that they support masking, especially in light of, or not in light of, but especially since teachers haven't been vaccinated yet.
And just to reiterate, as Dr. Buchanan said, certainly we want to take all these things into account. When we're looking at the vaccine, we really are going off of what the state is doing and using their plan because they did put a lot of work and a lot of science into it. But that's a very good point. Thank you.
Thanks everyone for your comments. If there are no other comments, we can go ahead. Any other comments from board on our speakers this evening?
Yes, this is Lisa. I'd like to say something.
Okay, Lisa.
Hey, I just want to talk about the masks. We do require masks in schools, and like Ms. Roma said, I think it's related to the board agenda tonight because they are discussing masks. So the teachers might be worried about that, why they are discussing that. But we do require masks, and I would just say that if you notice that at your school that someone's not wearing a mask, then you need to speak with the school administrator about that. And about the ventilation system, they have, I talked to Russ just a few minutes ago so I could get it, get it correct. The did something to the ventilation system where it turns over 3 times with the outside air. So the ventilation system is, working properly due to COVID. So there is increased ventilation. So I wanted to mention that as well. Thank you.
Thank you. Thanks for those comments. Any other comments from our board this evening on the public forum? If not, we'll move ahead to the next item on the agenda, which is approval of the minutes from January 27, 2021. These have been previously distributed, and if there are no major concerns with things, we can entertain a motion to accept in a second, and then we can have general discussion if there's anything more we need to talk about. Any motion to approve out there?
So moved.
Second.
So we have a motion and a second. Any discussion on the previous minutes from January 27? Hearing none, we're ready for a roll call vote on that. So Charity, I believe you are administering our roll call this evening, if you would, please.
Yes, sir. This is Charity Menifee with the Health Department. I'm doing the vote for the minutes. Dr. Gocher?
Yes.
Dr. Hurt?
Yes.
Dr. O'Brien?
I'm going to abstain as I was not present.
Okay. I skipped Mayor Jacobs.
Yes.
Thank you. Dr. Shamia?
Yes.
Ms. Wagner?
You skipped Ms. Rowe.
Yes.
She's not on here yet.
Oh, okay.
Sorry. Dr. Buchanan
Yes,
and Ms. Roma?
Yes.
she said yes.
Yes. All right. So we had 7 yes and 1 abstain. It passes.
You have approved the minutes from January 27, 2021. Thank you. The next item on the agenda is to set the agenda. And again, the agenda was distributed earlier this week electronically. After looking over that agenda, are there any additions, corrections, substitutions that we need? If so, we would need a motion for that.
I'll make a motion. We accept the agenda.
Okay, we have a motion. Do we have a second?
Second.
So we have a motion and a second. Any discussion on the agenda for this evening? If not, since you're ready to vote, Charity, if you will conduct a roll call vote on the agenda, please.
Yes, sir. This is Charity Menifee with the Health Department with the agenda setting vote. Dr. Gocher?
Yes?
Dr. Hurt?
Yes.
Mayor Jacobs?
Yes.
Dr. O'Brien?
Yes.
Dr. Shamia?
Yes.
Ms. Wagner?
Yes.
Dr. Buchanan?
Yes,
Ms. Roma?
Yes.
Thank you. Passes unanimously with those present.
Thank you very much. You have set the agenda for this evening. So the first item on the agenda at this point is the Knox County Health Department benchmark presentation by Dr. Buchanan. So Dr. Buchanan, if you're ready, we are ready to hear it.
okay. It's been a busy week for us here at the Health Department. This morning, as of 8:30, we opened a wait list for qualifying individuals to sign up through our website. If you see here, Catherine's showing, or somebody's showing, I think it's Catherine. The wait list can be found by visiting covid.knoxcountytn.gov. You must be eligible to sign up. Phase 1, 1A1, 1A2, or 70 plus. You can find those qualifications on our website as well. Those without computers can sign up by calling our public information line at 215-5555 or calling 311. We're really grateful to 311 for that partnership. You can also actually add your name to a standby list. And what that means is this list is used at the end of a clinic when we have maybe have extra doses because somebody didn't show up, or the Pfizer vaccine, sometimes you get more doses out of a vial than you expect to. So that we don't waste any doses, we want folks who can come at a moment's notice at the end of the day, either to the health department or to a central location where we're vaccinating and receive a COVID vaccine. So that's another option. That really helps our staff out, and I think people will be happy to sign up for that as well. Demand continues to be high, and we expect thousands of names to be added to this list, and it'll take time to move through them. Things went well with that launch today. We had a lot of phone calls, but we managed not to crash the county website, so that was a good thing. This week, we continue to provide second dose vaccines to those who received their first dose through KCHD at the beginning of January. We're also providing second doses to those living in congregate settings with developmental or intellectual disabilities. This is a priority group identified by the state and is one that we, public health, are responsible for vaccinating. It requires our team to go out to those congregate settings. So it takes a little bit more time. Because of that, we'll have, the health department will have given probably fewer vaccinations this week than you've been used to us seeing, because our team is working hard to get these at high-risk folks vaccinated. There are other opportunities to receive first dose vaccines this week through other providers across the community, and we're encouraged that more opportunities outside of what we're offering are coming on board to provide vaccinations. So be on the lookout for those appointments from some of our partners to get a vaccination. And honestly, the message to the community is if you qualify and you get the opportunity to get a vaccine, take the opportunity to get vaccinated. The more people that are vaccinated, the better it is for all of us. For an updated look at vaccine numbers across the county, we'll pull up our vaccine information page, which I think is already before us. We'll be updating this every Tuesday and Friday. And on this page, you can see more than 56,000 vaccinations have been given in Knox County. The health department, we've administered 13,000 of those doses. And on this page, you can see also broken up into first and second doses, and you can view the demographic breakdown of vaccinations administered across the county. And let's see where to go. So if you look at that 71 and older group, we've got almost a quarter of those folks vaccinated, so that's encouraging. So we're making progress, so that's great. Now we'll move on to the COVID-19 situation. We have 101 new confirmed cases since yesterday, 2,164 active cases, 70 Knox County residents are currently hospitalized. Wow. And sadly, we have 7 additional deaths to report today, raising our total to 509. So we broke the 500 mark in deaths this week, which is a sad mark to break. Moving on to our benchmark, the first benchmark, sustained reduction in our stability in new cases for 14 days. Over this time period, we saw daily new cases drop to approximately 127 cases per day, down from the previous reporting period, which was 140. As encouraging as these numbers are, the new cases per 100,000 and the percent positivity rate is still higher than we'd like to see. We will review these figures in just a few minutes. We'll review these figures under the supplemental data. Once again, we want to caution folks against accepting a high level of cases as normal. Even though these are lower than they have been in recent weeks, an average of 100 plus cases is still greater than we'd like to see in our community. I think we can all agree on that. And so because of that, we continue to represent this benchmark as yellow. Second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, we saw an increase over the past 7 days compared to the previous 2 weeks. However, it's still a lower volume of tests than we saw back near the end of the year. As we stated last week, we are hopeful that this is an indication of a lower burden of disease across the community, but we will continue to keep a close eye on it. We continue to urge anyone who has symptoms or has been exposed to COVID to please get tested. Regarding turnaround time, the number continues to be consistently less than 2 days across the community. Because of the lower testing numbers coupled with the shorter turnaround time, we continue to represent this as a cautious yellow. Again, we're worried. We're hopeful that testing volume is an indication of lack of disease burden, but as you know, if fewer people get tested, we're going to find fewer cases. So we want to make sure we're finding those cases. Third benchmark, sustained or increased public health capability. We're continuing to restructure this benchmark to better reflect what public health capability looks like with the change in focus. As the bulk of the response activities have shifted from case investigation and contact tracing to vaccine distribution. We are evaluating how we can best represent our capacity. While we restructure this benchmark, we are not assigning a traffic light color for this week. We hope to have it updated, and we hope to see continue. After speaking with our hospital partners, they recommend that the benchmark remain stable yellow. And as usual, Dr. Shami will have more about the hospital situation shortly. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time, we've seen 50 deaths associated with COVID, which is slightly down from last week. Since the beginning of the year, there have been an average of 5 deaths per day. The information available leads us to represent this benchmark as red. So I think that's a sobering number, an average of 5 deaths per day that certainly indicates that COVID is still very present, still very much impacting our community. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000. As of Wednesday, our 14-day trend line shows 26 new cases per 100,000. And our 7-day trend line shows 26 new cases per 100,000. That's unusual, which is down from last week, but it is still above the threshold as identified by the Board of Health. The second chart shows the percent positive of COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive for Knox County is 13.4, which is slightly down from last week as well, but it's still above the recession barriers as identified by the Board of Health. So happy to answer any questions anybody might have.
Thank you, Dr. Buchanan, for that report. Are there any questions from board members about our Knox County benchmark report?
So, Dr. Buchanan, just one, and I asked this a couple of weeks ago, so it's kind of a follow-up, or really just still on my mind, but as we see cases drop, and I'll show in a minute that they've kind of leveled off, to, that whole idea of contact tracing, containment, we knew once we got to a certain point that contact tracing wasn't really going to help us, but I guess there's that tension between the resources needed for the vaccine, which is clearly what's dominating the discussion and on everybody's mind, and then the future role of that more formalized contact tracing approach of what was being done in the beginning. And I know that you guys are thinking through that, but I mean, if we ever get into that containment phase again, and we don't contain, it'll get away from us unless we really get the herd immunity faster than I sense we're going to. And I don't think we're there, just in kind of what I'm sensing of hearing about more cases from this person or that person, and the fact that the cases leveled off. So what does that look like in your mind going forward as far as contact?
So, yeah, so that's a really, we've had that discussion internally. Fortunately right now at our current caseload, we're actually able to talk to most of our cases every day and reach them and educate them about, who to contact and what to tell their contacts. So we're hopeful that people will do that. We do that in other situations. We allow cases to identify their contacts and inform them. So we're hopeful that people are doing that. But I think what would be required for us to be able to take on contact tracing again is honestly vaccine to be more widely available, not just because of more vaccine, but because then the state will release it to more providers. And we will no longer be, along with the hospitals, one of the primary providers of vaccine in the community. As long as we are playing that role, shifting back to contact tracing is going to would be a real challenge for us. And so I don't know if Charity has more to say. Charity's more directly involved with that team than I am.
Hey, you can see me now. So,
yeah, we are talking about
that actively, and my speakers are muted. I don't know why it's doing that. Sorry. But we are talking about that actively in preparation to be ready to do that when we have capacity to get back to it. Our team right now is reaching out and getting almost all the cases at a way better rate than we were earlier when there was a high volume, and providing guidance. And in some specific cases, we will take it a step or two further in the contact tracing realm. And I just got muted. They can still hear you. Can you hear me? Okay. So sorry. And we will continue to explore what that looks like. But we are actively talking about that and know that that is going to be something that we need to be prepared to shift back into as we can.
So thank you. I do think that now that we're out of this 14-day quarantine paradigm, that we might actually, if we get to that containment phase again, I think the rules are a little more realistic about what people would potentially need to do. And so we might have it might be easier to operationalize and implement than it was the first time, just because that 14 days was just so hard.
No, totally agree. And I did it again.
And we hear that hopefully there's going to be some guidelines that we can implement moving forward even more as we're getting people vaccinated, and how to handle quarantine in that realm as well. Will make things even more palatable for folks moving forward soon, hopefully.
Thank you.
Dr. Goetsch, I just have a couple comments, if that's okay, please.
Sure.
First, I'd like to thank Knox County IT and the health department's team that works on the website that Dr. Buchanan just showed, as well as the platform that allows the waiting list and the call list. I think if you look at Knox County's website and compare it to other websites of the big health departments, the counties that have their own health departments, I think ours is the best in the state by far. And also with the new kind of scheduling platform, a lot of work went into that, both on the side of our IT as well as Dr. Buchanan's folks that work on that. And I'd also just once again like to thank Dr. Buchanan and the Knox County Health Department for the outstanding work that they have done throughout this entire pandemic, from the beginning when so much is concentrated on contact tracing to now when it's been shifted over to vaccinations. The health department does vaccinations, but they're normally there to fill the gap. And they've been thrust in the role as one of the primary providers now. They've done an outstanding job with everything that they've done. So we often forget about that because this has become a part of our life over the past several months, and it's almost somewhat mundane at this point. And we expect that out of them. But we should remember just the great work that they do, and we're all very thankful for them.
Thank you for those comments. Any other comments from board members? If not, I'd like to thank you, Dr. Buchanan, for a very thorough report this evening, and optimistic news about the vaccination rollout. Next on the agenda is the University of Tennessee Medical Center's Knoxville data update. Dr. Shamia, if you are ready.
Yeah. So, okay, so probably get through this pretty quickly. Next slide, please. So the point to make here is something we'll kind of see repeatedly, and that is that we had that really significant spike where you see in the county, it was nearly 4,000 cases in a 7-day period. And we had that pretty steady week over week drop. At one point it leveled off, but then you see both in the county and the district in the last 2 weeks, it's pretty flat. And so you also just keep in mind that 1,200 cases per week was something that when you look back at the beginning of November, we hadn't hit that at that point. And so we just broke 1,000 cases per week sometime in that kind of mid-November timeframe. And so I don't know yet if this is where we're going to level out in the county and then in the district. But if it is, I think that just drives home the point that this is not over. That's still a very respectable number of cases, certainly a lot better than what we had seen before. So we'll just have to continue to watch that. Next slide, please. So that same pattern is being seen across the entire state. So everybody dropped at around the same time. So that was definitely real. That wasn't just because we had snow around Christmas. I mean, that was something real happening, but everybody has also started to either slow down or level out. So it just seems like it's behaving as you would expect it to behave if something was happening consistently across the state with the disease pattern. Next slide, please. So then when you break that across the ages, also very stable, really. I will say that in 71 and older, not a lot going on right now, which is good news. And so up until now, there has been an increasingly strong correlation between cases and hospitalizations. You get more cases, you can to some extent predict how many hospitalizations. I don't yet know whether that's going to change. As Dr. Buchanan showed, we're starting to really have an impact from a percentage basis in the number of those who are 71 and older who've been vaccinated. And so it may be that it doesn't predict quite as well cases to vaccine if the cases are in people, cases to hospitalizations, if those being diagnosed are less likely to be hospitalized based on their age. So we'll just have to see how that goes. But the other point is that it doesn't matter which age group you look at. Once you get below 70, it isn't continuing to drop. It's seemingly leveling off. Next slide, please. And so on the positivity rate, Dr. Buchanan made a point about watching how much testing we're doing. I made the point about mitigation or containment and the contact tracing, but you got to test before you can even get to the point of contact tracing. And so we're still testing a reasonable amount. I think one thing we need to keep in mind is that that's part of, if we're not testing, the positivity rate will not continue to drop. This is both positive cases and number of tests, but we have seen that continue to drop. We really want to get to that 5%, and it looks like getting below 10% may actually be attainable at this point, depending on how much we truly have leveled off and whether we spike again. Next slide, please. So this continues to lag because what I'm about to show you with the hospital census really continues to show a very significant drop. So these new hospitalizations, I would expect when it gets all caught up, we'll see continuing to drop. But I just don't think it's quite up to date yet. Let's get to the next slide. That tells more of the story. So this is the day-to-day hospital census across the district, across all these hospitals. And so we were at 615, and it's been this really steady decline since that time. And so we're actually below the hospital census that we were there in mid-October when we plateaued. This is obviously very good news. That's still a respectable number. I can remember when we got to 185 back in the summer, we were all quite alarmed at that point. But we want to continue to see this trend, and we'll have to see what the variants and the cases do and how that leads to hospitalizations. Next slide, please. And then certainly the projections become, when the trend is down like that, the projections are going to be down as well. I do not realistically think we'll be at 0 hospitalizations in March. And so I always say, take these projections with a grain of salt. And so I believe that concludes. Next slide, please. Is that it? So Dr. Goetsch, I'll be happy to take any questions.
All right, thank you, Dr. Shamia. Any questions from the board on Dr. Shamia's report this evening?
Not really a question about the report, Dr. Shamia, but are y'all having any conversations or concerns or seeing any indication of the variants that might be circulating? Certainly wouldn't be surprising if they are circulating. From the medical standpoint, that happens, but any discussion among the hospitals about those concerns?
Well, it's certainly, we talk about it simply because we have to try to plan for it, but we don't test specifically for those variants. I mean, we find out if someone has COVID with our routine test, but we are not able to say whether it was a variant case or not. And certainly based on the clinical presentation, we're not at a point where we can suspect that this, based on how this person presented, they're more likely to have this variant versus this person. I do think that what we're going to have to keep careful eye on, though, is our non-COVID hospital census, because we're still quite busy. And there is this sense that one thing we're seeing is that when a patient who's had COVID may not be in the infectious window, but they're still having trouble. And so they still may present to the emergency department, still may even be admitted to the hospital. Then there's that whole other thing we saw in the spring where some people electively deferred care, somewhat necessary care, just because they didn't want to be in the hospital around the time, as much as we've encouraged people that hospitals are safe. And so are we going to start to see more of those other medical illnesses that are maybe in a worse situation than they would have otherwise been present to the hospital? And so I think one of the things that concerns me would simply be, if it's going to take off again, is it going to be faster than it was before? Because we've kind of gotten a cadence of being able to look at cases, look at our hospital census. There's a lot of patterns in all this. And we were able to plan for non-essential procedures, plan for opening surge areas. And so if it's a different calculus this time and we don't know it, that will be something we'll have to react to. So we're kind of primed and ready for that, but with these variants. But beyond that, we're just going to have to see how it plays out.
Yeah, I think that discussion is very relevant when we get to the mask ordinance.
Dr. Shimi, I have a question, or see if you have a comment. Do you have any information on the vaccination efforts from either UT Medical Center or the other hospitals in the area, how those are going, any difficulties, how their goals are coming along with those?
Well, I can certainly speak to our vaccination effort, and as far as specifics, I can't speak to the other health systems, but we all collaborate. It's interesting that community call that we have already set up, where it was 5 days a week and now it's Monday, Wednesday, Friday. That's a capacity call and a vaccine coordination call with Dr. Buchanan, so that we're all trying to coordinate what we're doing. And she's been fantastic to make sure that the supply is going to the right place the right week, and all those kind of things of the various people who are partnering. So we have given, I can say at UT Medical Center, over 17,000 doses. That's a mixture of first and second doses. And of course, the initial part of that was to our team, but then it extended to community healthcare workers. And now we have, as we're able to, we try to participate in offerings for the eligible groups, including those who are 70 and over. And just as what's been said already, is that we're always trying to scale that up. It's limited just to the extent that the vaccine supply is there. I know that the different hospital systems have come up with different ways to operationalize that. It's whatever made sense for everybody to do. But the end result is that, everybody is doing sometimes their part for those that are 70 and older. Some are focusing more on the remaining healthcare workers that are not affiliated with hospitals. But I wouldn't say there's been any fundamental barrier or challenge. I will say we almost crashed both our phones and our website with one of our offerings. And so the volume that you get is just really impressive. And so there's a lot of planning that goes into this, and folks who are also doing, kind of volunteering their time for this when they have their other healthcare jobs to do. But the main limitation is just the supply. I don't know if that answered your question, sir.
I think it has. I just want to commend the efforts of UT Medical Center and by inference all the hospitals in the community. I've had an opportunity towards the end of the day to go by, and I see the elderly patients that are not healthcare workers. They're being readied for vaccination. I've had an opportunity to talk with the team members that are involved in vaccination a little bit, and it's a well orchestrated event. You know, with Pfizer it has to be, but it's so well orchestrated. Well done job.
Well, thank you. And I would extend that as well to all of our other healthcare partners and also to Dr. Buchanan. I will say that we have a lot of people who are, we have volunteers that work in this and also just our staff. And I think repeatedly say it's one of the most fulfilling things that they've been able to do in several months. And so with all the stress and everything we've had to deal with, the level, that interaction, that very human interaction between the people who are trying to help and then those folks who are getting the vaccine, believe me, we'd love to give a lot more vaccine as soon as we're able, because it's just about the most satisfying thing they've been able to do in quite some time.
Dr. Shamia, I would like to compliment you on, you're becoming more of a politician when you use the term impressive. What do you say about the demand for the vaccine? That's a very good choice of words.
Yeah, thank you.
Any other comments on the UT Medical Center report? If not, again, Dr. Shamia, thanks for the continuing good work. Next item on the agenda are questions for the educational institutions. And I earlier saw Dr. Gregg on. Dr. Gregg, are you still on?
Yes, sir. I'm still here. I'll be happy to take any questions. I will
hear a report from you or any addition to the report you submitted.
Really nothing to add there. We're quite pleased with our positivity rate on campus. We're still remaining below 1% on our campus testing. We are testing on average at least a little under 5,000 students each week. And of course, we've involved our commuter students as well this semester, which is new for us as well. And would also like to say that we've also been working with Dr. Buchanan in the health department and had our first vaccine event this past Friday, where we're not certainly where the UT Medical Center is, but we were able to vaccinate 563 phase 1A1, 1A2, and over 70 age group individuals, and actually have 2 more public facing events, one tomorrow and then again on Friday. So we're certainly pleased to be able to assist our county in reaching their goals of vaccinating as many people as possible, and really appreciate the opportunity to participate in that.
Thank you, Dr. Gregg, for that report. Knox County Schools, Ms. Wagner, do you have any additional report? I know one has been submitted in writing.
No, I don't have anything additional to add, but I'll be happy to answer any questions that you might have.
Any questions from the board to either Dr. Gregg or Ms. Wagner?
I have a question for Ms. Wagner, and this actually might be pertinent for Dr. Buchanan as well. And it's just a question that I've been asked is about antibody testing to get students back into school. And I just had some folks ask me about that.
No, it just says that you've been exposed, but it didn't tell you when, if I'm correct. Is that right, Dr. B?
Correct. So yeah, the antibody test is not all that useful in those situations. It doesn't tell you anything about immunity, truly. So it's really, antibody testing is more, and Charity, you may have to help me with this, is more a surveillance tool than it is a tool to use to decide if somebody has disease.
Yes, and just
unmuted us.
hey, this is Charity at the health department. Just to add to that, Dr. Buchanan's correct, and the state has actually removed antibody testing as a reportable lab at this point because of that. Because it's not, unfortunately, as much as we would like it to be. We had easier access for those things, but it's just not a useful tool for those decisions.
So if I could ask a follow-up question, that I have a friend who's, I don't know what school their child goes to, but that was being used, I believe, as a potential, if you could submit an antibody, then that's a way. I'm not sure I'm not saying this was the county or private, I really don't know, but to reinforce what Mayor Jacobs had asked, I mean, that is out there a little bit, I think. And so do we have a sense if that's being used in the schools?
It's not in, well, Lisa can talk about Knox County schools and then I'll talk more.
No, we're not accepting those. We have parents that ask, and we always, provide that information that we don't accept those and try to explain why we don't accept those.
I had been asked previously, some private schools made decisions to utilize that occasionally. We've advised against it, but that's their decision to make on their return from quarantine and isolation and such.
Thank you.
Thanks for those reports. Any other comments from board members for our educational institution reports? If not, thank you all very much for your information. Next item on the agenda, number 11, is review and discussion of our regulations. And so under item A is the face covering regulation, which was our 2020-1 starting July 1 of last year. And any comments or discussion on 2020-1?
I think all I would say is that as you know, our risk of having the variants, which are more contagious than the current variant, the primary variant circulating in Knox County. We're not doing variant testing, but the primary variant circulating in the whole country right now is not, we don't have widespread transmission of the new variants, but certainly not the time to stop the mask mandate. And I believe I saw something from the CDC that I haven't had an opportunity to read with more information about masking and the need for masking. So certainly not the time to change that. I think we need to continue that and encourage everyone to continue that, whether they're vaccinated or not. So, and we really, honestly, at this point, don't get a lot of complaints about it. We actually passed a little milestone. We've almost handed out all of the masks that we got from the state of Tennessee. I wish I could remember that number because it's a huge number.
I would say it's over 400,000.
Over 400,000 masks from the state of Tennessee we've given out. That's right, because I said we've almost given out enough for the whole population of the county in the last several months. So masking continues to be important. It continues to be an important tool. If these numbers level out and stay where they are, that's great. But I'm afraid if we take the lid off and remove masking, those numbers, I'm not afraid. I'm sure that if we take masking away, those numbers will not level off and they certainly won't go down.
And I would just like to agree with Dr. Buchanan and reinforce that is that where we are right now in those cases, and again, it does seem more like we're probably at a point of plateauing and we're still at a higher level than we were a few months ago. We would not be there, I feel very confident, if it wasn't for the fact that we're with masks. And so to contrast that with where we are with influenza, and we've said this before, is we've had good influenza vaccination rates, but still in a normal year, we have a lot more flu than we've seen this year. And so the fact is that we've got some people who've been immunized and some people who already probably carry some immunity because of how many times they've been exposed to the flu in the past, which is different than this. And so we're seeing these very, very low flu numbers. We're still seeing very respectable COVID numbers. They're just down from what they were. But if we didn't have those masks, or if we took those masks off, we're just going to be inviting, even without variant situation. And then you add the variant into that, we're inviting to be right back where we were, which was not a particularly good place just a matter of several weeks ago.
Thanks for those comments. Are there any other comments from our board members on 2020-1? If not, we'll go to item B, which is the restaurant occupancy limitation and early closure, which is 2021-1. This was the change from the early closure and occupancy limitation that was enacted at our last meeting, extending closing time from 10 until 11. So any comments from our board on 2021-1?
So I'll start just based on what I've just described as far as the leveling off of cases. My inclination would be to continue this as is.
Are you making that as a motion, Dr. Shamia?
Yeah, I certainly can. I move to continue as is with, you have to, it's the date that's going to get me
Right.
to,
Let me help you out, March 4th.
okay, so
March 4th would be 2 weeks.
Okay, is that at 12:00 or at 11:59 or however it's worded, just March 4th? Okay, so I move that we extend this until March 4th.
We have a motion. Do we have a second?
Second.
So we have a motion and a second. Discussion on 2020-1 being extended for a 2-week period. Any discussion from board members? Hearing none, since we're ready to vote. So Charity, if you will conduct the voting for us on a roll call, please.
Yes, sir. Voting on 2021-1 to extend to March 4th. Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
No.
Dr. O'Brien,
Yes.
Dr. Shamia,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
Ms. Roma.
Yes.
Passed 7-1.
So you have adopted 2020-1 extension until March 4th. Next item on the agenda, item C, is COVID-19 social gathering limitation regulation 2020-8, which expires February 18. Any initial discussion on or comments on 2020-8?
Make a motion to extend it to March 4th, 12:01 a.m.
So we have a motion for 2020-8 to be extended. Is there a second?
Second.
We have a motion and a second. Discussion on 2020-8 extension. Comments, thoughts?
I think as we discussed to some extent 2 weeks ago, this one is probably more important in terms of the message that it sends, or that the message that not continuing it would send. And I do have concern that this is a risk point for us locally. And I think given the level of fatigue that everybody's feeling, and so I just want to be careful. We just had the Super Bowl. I am concerned about that, to be quite honest. I don't know about you, what sense you're getting, but I really do in my heart and in my discussions with people, I think they really were careful around the holidays. I think there were a lot of things people chose not to do and a lot of gatherings they chose not to have. I'm not sensing as much that that's as much the case. And so I think we need to be careful about the message that we're sending, that this is still an important time for us to buckle down, or it could possibly go in the other direction.
Any other comments, discussion on 2020-8 extension to March 4? Hearing none, since we're ready to vote, and Charity, if you'll conduct a roll call vote on the extension on 2020-8, please.
Yes, sir. Charity Menifee, Health Department, conducting the vote on 2020-8 extended to March 4th. Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
No.
Dr. O'Brien,
Yes.
Dr. Shamia,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
Ms. Roma,
Yes.
passes 7-1.
Thank you. You have adopted 2020-8 extension. The next item on the agenda is other business. So is there other business comments, concerns from our board members this evening?
Dr. Goetzer, I do have something, and this is nothing the board can do anything about other than just to kind of bring it to your attention and maybe ask for some advice or guidance. Earlier last week, single mother called and my office, and I talked to her, and she has, I think, 3 young children, and she's having trouble getting to the doctor's office because there's only like her and the patient allowed, and then she has trouble finding childcare for her other kids. And it just, again, nothing that you all can do about it, but just maybe some ideas of workaround on that and what the guidance is, and maybe some advice you'd have for her or her practitioners. Thank you.
Any comments or ideas on that?
I can just, Mayor, mention that we do talk, at least the health systems. I mean, we talk about visitation periodically. Now, the term visitation is more applicable to an inpatient setting where you're talking about an office visit, but those restrictions are very much in place. And it just has to do with just the probability, as we know, the more people there are, the more likely one of them has COVID, and then they're exposing other folks. All I can say from our standpoint, obviously I don't have a solution for that particular situation, is that we're very not only receptive, but we're already actively talking about visitation. And is there a point in time where that it kind of starts to open back up? I think the challenge in that is that I don't see us getting to, I mean, what was effectively just no limitations whatsoever. That I don't see us getting there, and then the steps in the middle become very complicated to manage. A lot of these things related to COVID have created these situations out of nowhere that are just hard to put structure around. And so whatever you decide you're going to do to loosen those restrictions, if it's so impractical that you can't possibly communicate it or regulate it, then it's not a good solution. And so it's trying to balance those issues essentially, but we do think about it.
I think, Mayor, you asked me about this, and it's a real challenge. It's, physicians' offices make their own regulations up about how they're going to manage patients during COVID and any other time, to be honest. We certainly encourage, and I'm sure the hospital systems encourage people to work with their patients to resolve those issues, to help find creative solutions. I don't have those creative solutions, but encouraging providers to work with patients and families to find creative solutions. But again, sometimes hard to do. And I feel for them. I've had times when helping my dad with things where I couldn't go in with him, and he's an adult who can speak for himself, but it's hard when those things change and there's not a solution that's easy to come up with.
Dr. Buchanan and Dr. Shamia, thanks for those comments. Any other comments or discussion? Dr. Buchanan.
Yeah, so just a couple things. One is just to advise the board. I'm not sure if all of you are aware, but we had an incident where we had 900, we had a whole tray of Pfizer vaccine that was inadvertently disposed of. The Pfizer vaccine comes in a pretty nondescript box and without packing packing slips, that's the word. And it was a set of second dose vaccines that we had not been given advance notice that they were coming. And it looked like a pack of dry ice, which they also ship. And so we have talked with the state, we're working with the state on two things. One is just really understanding how it happened, because they also have GPS trackers and temperature probes. And so, how could this happen? And that we were the ones who noticed it, not Pfizer or the state or whoever was tracking that box. And also working and changing our internal process, certainly putting some safeguards in place that were not in place before, and double checking and going back and looking at that. Really, really proud of my team for their speaking up and their integrity. This is, if you've ever met any of my team, they have a passion for protecting the community and work really hard and diligently, and doing something like this where they know almost 1,000 doses that could have gone into patients to protect them won't now. The second doses that this was intended for, those folks are still going to get their second doses. We had a tray of vaccine that we were in the process of planning for, so we're able to use that for those second doses. So nobody's going to miss their second dose because of this, but I wanted you to be aware of that. We announced it today, and I did a little press briefing at 3 o'clock about it. And so I'm happy to answer any questions that you might have about that. So if anybody has questions, I'll entertain them.
Any questions from board members?
So there's also a couple other things. One is the governor's executive order expires February 27th. And so that, I don't know how, I guess, Mr. Sanders, it's a question for you, that I don't know how that impacts or does not impact the authority of the board. And I don't know if, not something you necessarily need to answer at this moment, but if you could look at that and advise us. I don't know if it will be extended. I honestly we don't know until it happens or doesn't happen. So just looking at that, how it impacts the board, how it impacts any regulations we might have in place, that would be helpful for us.
I'll be glad to look into it and send you all something.
Okay.
Dr. Buchanan, at a 2-week interval, our next meeting is going to be on the 24th of February, so that'll still fall within his executive order, and the one after that is 3/10, 2021. So that's the one that might be impacted, depending.
Well, actually, I mean, yeah, I don't know how if it impacts the board's authority. The board's always met, so the board's always been in existence. Well, as long as I've been here, the board's been in existence. So meeting is really the authority of the board, and I'm just not sure. Again, not being a lawyer, I'm not sure if there is an impact or not. So I think that's something that we can rely on Mr. Sanders for.
Okay.
And then the other thing is that we will probably ask, unless something is going on extremely with COVID, we will be looking to dedicate a meeting probably in, let's see, our budget's due this month, probably in April, to the health department budget. We'll get that out to you before that, but I want to set aside enough time for you to ask questions. And we might forego some reports, or kind of abbreviate some reports so that we have time for that. But you'll have advance notice for that. But I just wanted to put that out there.
Thanks for the heads up, because we'll need to do that at some point this spring. Any other comments in the other business section from board members tonight?
Just another comment for Dr. Buchanan, just reiterating, we're very lucky and thankful for you and your team. You all are doing a great job, so keep your chin up.
Thank you.
Any other business to come before us this evening? If not, we'll entertain a motion for adjournment. And with that motion, we would see everybody in about 2 weeks.
Motion to
Great.